Good day, everyone. Welcome again to another session of our nursing health assessment. In this episode, we are to discuss the neck assessment. First, we'd like to have a little short review on the structures that are involved in the neck. Okay, so the neck is composed of the cervical spine, which actually holds the skull or the cranium. Other than this, it has some of the thyroid glands, your larynx, part of the lymph nodes, of course, and of course, some of the cartilages. The muscles that makes up the neck, the major muscles are the sternocleidomastoid, and of course, your trapezius muscles. Others involved are your splenius, levator scapulae, medial scalene, and the anterior scalene. So in the assessment of the neck, we would want to use the following techniques: the inspection, palpation, and auscultation. So how do we start the procedure? Of course, as we usually do, we start by greeting the patient, an afternoon or a good morning, and we would like to introduce ourselves as the nurse of the patient. Of course, we would want to verify the procedure that we are going to do. After that, you have to explain the procedure to the patient so that you'll be gaining consent from the patient as well as his or her cooperation. Providing privacy is necessary and therefore performance of hand hygiene after. So we'd like to inquire about the history of our client, especially in terms of the structures and physiology of the neck. So we would want to ask if there are any problems with neck lumps or a history of lumps in the neck. Ask also if there are presence of neck pain or any stiffness. And if there is, you ask the PQRST of pain, of course. We would want to know also the levels of pain by asking um, the range from 0 to 10 for the presence of pain, and when and how any lumps have occurred. You ask also for any previous history of thyroid problems, be it hyperthyroidism or an increase in the levels of the thyroid hormones, or hypothyroidism or the decrease in the levels of the thyroid hormones. Ask also if there are any treatments or surgery or radiation that is involving the neck structures. Then, we would want to assess the neck muscles. By inspection and palpation, look for the neck muscles, specifically the major two muscles, the sternocleidomastoid and the trapezius muscles. Look for an abnormal swelling or presence of mass, and ask client to hold the head erect or extended so that we may be able to observe properly the structures. So this is an example of a nodule on the sternocleidomastoid. This line is a sternocleidomastoid. So this may be an inflammation of the sternocleidomastoid that we should be able to observe from your client. Look also for the accessory clavicular uh, belly in the right side and of course onto the left side. Here in this patient, you can see an uneven sternocleidomastoid, right? There's presence of sternocleidomastoid insertion here, and therefore on the other side, it is absent. Next is that you have to observe the head movement or the range of motion by asking the patient to do the following. So first, we would like to ask the client to turn head from left and the right. Okay, so left and right. This assesses the strength or the activity of the sternocleidomastoid. Next one is we ask the patient to move the head closer to the ear, both left and the right, towards the shoulder, and assesses all as well the sternocleidomastoid. Third is that we ask the client to move the chin towards the chest, such as this one, or do flexion in short, to assess as well the sternocleidomastoid. And lastly, extend the neck by putting the chin up for hyperextension. So what do we usually find from the neck of the patient? Of course, when we do ask the client to move his neck, there should be a full range of motion. Okay, the patient would be able to perform the left and right, the ears to shoulder, left and right, and of course, chin to chest and chin upwards without any difficulty, pain free, and of course, there would be symmetrical muscles, and no presence of masses. Abnormal findings could be there are limitations in the range of motion that a patient can perform, and there would be presence of pain as a patient move his or her neck, asymmetrical muscles, and of course, presence of mass during the assessment. After you inspect and palpate the patient's neck, and of course asking the patient to do certain ranges of motion, now we would want to assess for the muscle strength of the neck. So we can do that by asking the client to turn the head onto one side against the resistance of your hand, and of course you would want to repeat that onto the other side. So this determines the strength of the sternocleidomastoid muscles. So, of course, our normal finding is that there would be resistance as a patient uh, turns his neck onto the other side as we do our resistance. Okay, abnormal finding is that the neck would be rigid and stiff. You can also assess for the trapezius muscle by asking the client to shrug shoulder against the resistance of your hand. Of course, the normal finding with this one is that the client can lift his shoulder as we give resistance or give weight to his or her shoulder. Inspect and palpate the trachea for presence of lateral deviation. We can do that by placing the finger or the thumb on over the trachea in a suprasternal notch, such as this one. Remember that the suprasternal notch is the indention at the midline, just below the trachea or just below the thyroid gland. You can move the finger laterally onto the left side and to the right side in the spaces bordered by the clavicle. And of course, the anterior aspect of the sternocleidomastoid muscle and the trachea. So normal finding is that the trachea is found to be at the midline, and we have to look for tracheal shift either to the left side or to the right side. So abnormal findings is, of course, there would be deviation to either of the sides. So this is how you can perform the tracheal deviation. So determine the position of the trachea by palpating at the center, then to each side, to the left and to the right side of the patient. So this is an example of a deviated trachea, as we can see in patient. Next one, after checking the trachea of the patient, now we would want to assess the thyroid gland. Remember that the thyroid gland is a butterfly-shaped gland that sits low in front of the neck and lies below your Adam's apple, along the front of the windpipe or the trachea. The thyroid has two sides or the two lobes connected by a bridge, which is called as the isthmus. So the right lobe and the left lobe, and it is connected by the isthmus in the middle. When the thyroid is its normal size, you can feel it actually as you do palpate. So we can do inspect the thyroid by looking at the neck of the patient. So we can stand in front of the client and observe the lower half of the neck overlying the thyroid gland for symmetry and possible presence of mass. You can assess the thyroid gland by, or palpate specifically, the thyroid gland in two ways. You can stand in front of the patient or you can stand from behind. Either way is correct as long as you perform or you follow the guidelines. So from behind, you place 3 fingers along the midline and move then to both sides, to the left and right, and ask the client to swallow. You can aid this one by asking the client to drink a little amount of water. At this point, you would want to assess for the symmetry of the lobe elevation as the client performs or do swallow. Ask the client to extend the head and swallow. If necessary, you can offer a glass of water to make it easier for the client to swallow. So this action determines how the thyroid and the cricoid cartilage move and whether swallowing causes bulging of the thyroid gland. So as we know that the thyroid gland normally is found on the middle of the anterior of the trachea. So the isthmus as the center, and it has 2 lobes that's lying onto the left side and to the right side. Normal findings are as follows: symmetrical movement as we do swallow. Adam's apple or the thyroid cartilage is more pronounced in males, and no masses, tenderness, or enlargement is present. And of course, as we do auscultate, brewery will not be heard. Abnormal findings are presence of mass, enlarged gland, presence of goiter, asymmetrical enlargement, and presence of nodule or a brewery upon auscultation. So this is another example on how you can properly palpate the thyroid gland, both the left side and the right side. So this image is palpating the thyroid, right posterior approach, and of course, onto the other side, the left posterior approach. So this is an example of a patient having a goiter. Remember, when we do say goiter, this is an enlargement of the thyroid gland. So although goiters are usually painless, a large goiter can actually cause coughing and make it difficult for a patient to swallow or at times to breathe. And the most common cause of goiters worldwide is usually lack of iodine from the diet. So as you can see in this patient onto the left side, there is enlargement of the thyroid gland as well as onto the right side. However, this one is symmetrically large and this one is asymmetrically large. Okay, it's larger onto its right side than on the left side. So this one is an example of a thyroid nodule. So a presence of a nodular mass at the thyroid gland of the patient. So this is the reason why we would want the patient to swallow or to at least drink water as we perform the assessment because it allows the masses or the lump to be more prominent as we do swallow. That's why we ask the patient to swallow for us to be able to easily palpate those presence of lumps, nodules, or any other kinds of masses from the neck of the patient. After doing so, we can now palpate and auscultate the carotid arteries of the patient. When we do palpate, of course, we would want to record or take note of the volume and the character of the pulsations. At times, you can also check the rhythm of the pulsations. Auscultate, after palpating it, auscultate the carotid arteries. The side of the stethoscope that you should be using is the bell. Okay, it is necessary for you to listen for the presence of bruit. Remember, the bell is used for auscultation of a low frequency sound. So at this point, you instruct the patient to hold his breath while you listen to the arteries. So the bell is used to listen for low frequency sound like bruise, and asking the patient to hold his breath allows you to clearly listen to the pulsations and prevent the breath sounds to interfere your findings. After doing so, you can now palpate the entire neck for enlarged lymph nodes. So you may do it in front of the patient or doing it behind. Okay, so bend the client's head forward slightly or towards the side being examined. So the technique to do or to use is, of course, light palpation. So palpate the entire neck and specific node with pad fingers moving in a gentle rotating motion. So asking the client actually to uh, slightly uh, move the head forward is that it relaxes the soft tissue and the muscles. So there would be no tension as you do palpate the lymph nodes. So the following are some of the areas that we can palpate. Of course, this is your mentum, no? So there's presence of submentum lymph nodes herein. The submandibular lymph node, the upper jugular lymph node. We do have actually a preauricular lymph node herein, meaning pre just because it is before the auricles, and post-auricular nodules or post-auricular lymph nodes present at the back of the auricles. There are also presence of posterior and the posterior triangle lymph nodes. Okay, and of course your supraclavicular. Why is it called supraclavicular? Is just because of its location just above the clavicle. At the back portion, at the nape of the patient or the nuchal, we do also have your posterior uh, lymph node, and of course occipital on that area. Palpate the entire neck for presence of enlarged lymph node. Locate the position at the submental and the submandibular nodes, such as in this patient. So you can do it by placing the fingertips under the mandible on the side nearest the palpating hand and pull the skin and subcutaneous tissue laterally over the mandibular surface so that tissue rolls over the node if in case there is or there are nodes. Next one, you check onto the anterior. Remember, anterior cervical nodes, meaning in front, and the posterior cervical nodes. The anterior and the posterior cervical nodes. Move your fingers slowly in a forward circular motion against the sternocleidomastoid. Moving forward in a circular motion makes us assess the the size and of course the edges of these lymph nodes. We can do deep palpation of the cervical nodes by bending or hooking your finger around the sternocleidomastoid. So for the supraclavicular nodes, just above the clavicles or the collarbones of the patient, such as this one and this one, you may ask the client to bend the head forward to relax the tissue of the anterior neck and relax the shoulder so that the clavicle may drop. Use your hand nearest the side to be examined when facing the client. For example, the left hand for the client's right nodes. Use free hands to flex the client's head forward if necessary. Hook your index finger and third fingers over the clavicle lateral to the sternocleidomastoid here in this area. You assess also the preauricular lymph nodes herein, then the postauricular lymph nodes at the back of the ears. Palpate also for the posterior cervical lymph nodes. So you start again from the preauricular, postauricular, then going down to the posterior cervical lymph node. As you can observe here in the nurse is using a rotating motion as he is slightly moving downwards. And of course, lastly, your occipital lymph nodes. So palpate mass and assess for presence of fluctuants and describe the size, the shape, the edges, location, temperature, and any skin changes. And of course, check its relation to the underlying tissues. So the findings for our lymph nodes, of course, normally they are non-palpable. It can be palpable if there would be presence of infection to any nearby structures. Of course, lymphadenopathy is what we use to describe an enlarged lymph node. There could be some tenderness. When we do say tenderness, there's presence of pain as we do palpate. And at times, the lymph nodes could be firm and hard as we do palpate them. After doing so, you can now remove your gloves if in case you utilize your gloves and perform hand hygiene. And lastly, it is necessary for you to document the findings in the client record for proper transfer of data. So thank you for listening. That ends our discussion on the assessment of the